divided into two types, that is the extrinsic. So there is an extrinsic type as well as there is a intrinsic type of asthma. So now we'll compare both of them, that is the extrinsic and the intrinsic. So to start off with extrinsic, so firstly we'll be looking at only the extrinsic, then we'll move on to the intrinsic. So this extrinsic, if you see the other names, so the other names, it includes the atrophic, it is known as the atrophic or the allergic. It is also known as the atrophic or the allergic asthma. So what are the conditions it is associated with? So it is associated with the atopy, it is associated with atopy, then it is associated with drug, it is associated with food, and also the allergy. So what is meant by this allergy? So it can be by past as well as in case of the family history. Next, we will move on to the onset. So when does this extrinsic asthma take place? So if you look at the onset is that it occurs in case of the childhood. And then what about the inflammation? So under inflammation, it is the eosinophil mediated. So E for extrinsic and E for eosinophilic. So it is eosinophil mediated. Next, when we compare the IgE levels. So what about the IgE levels? The IgE levels, it is slightly increased. It is increased and it is nothing but the type 1 hypersensitivity reaction. Then when you look at the most common trigger, so what is the aspects which trigger it? So it is nothing but the dermatophagoids. The dermatophagoids, that is by the house mite. So now we will be moving on to the response to the inhaled corticoids. So how does it respond to the inhaled corticoids? So here is the response is good. So it responds well. And what about the prognosis of the extrinsic type? The prognosis is also good. Now we just discussed the extrinsic asthma. Now we'll be moving on to the intrinsic type. So what is special of the intrinsic type? So intrinsic will be covering the same headings. So we saw the other names. So what are the other names? The other names, it includes, there is a non-atopic, it is a non-atopic, and it is non-allergic. Non-atopic as well as non-allergic. And there is a also known as the idiosyncratic. So it is a idiosyncratic asthma. Then when we look at what is it associated with. So this associated with is that the Samter's triad. There is something known as the Samter's triad. So what is special about the Samter's triad? It includes the presence of aspirin. So there is aspirin sensitivity, there is presence of the asthma, and there is the sinus disease. So there is presence of the sinus disease, and the sinus disease is with recurrent nasal polyps. So there is a recurrent nasal polyps. So this is the what is it associated with. Next we have the onset. So where does the onset take place? So onset, if you see, it is taking place in the adult. Onset is that it takes place in the adult. And what about the inflammation? So if you look at the inflammation it is nothing but neutrophil mediated, whereas in extrinsic it was E for E, that was it is extrinsic for the eosinophil mediated. So here in intrinsic it is nothing but the neutrophil. It is a neutrophil mediated. Next we will move on to the IgE levels. So comment on the IgE levels. The IgE levels, it is normal, whereas in case of extrinsic it was increased. Here it is normal and there is a negative. There is a negative skin prick test. Skin prick. There is a negative screen prick test. Next, we'll move on to the most common triggers. So if you look at the most common triggers, it is nothing but it is a super antigen. It is super antigen. And there is a staph aureus, S aureus, and this is the enterotoxin. Enterotoxin. Now, we will look at the response to the inhaled corticosteroids. So what is the response to the inhaled corticosteroids? So what is this response? So the response is there is a decrease. There is a decrease in the short-term response. There is a decrease in the short-term response. And what about the prognosis? So prognosis in this case is that it is bad compared to the extrinsic asthma. So this was about the extrinsic asthma and intrinsic asthma. To learn and grow daily, please do subscribe.